Hello and welcome to the Art of Being Human. I'm going to today talk about a little bit about the human brain. Now, I've talked before about the women's cycles and their reproductive physiology. This is kind of an extension from that, because everything that happens in the female body, in the male body too, but basically in the female body, and this is what I want to relate it to, has to do with what's happening in the brain. So I'm just making some general statements, and I'm going to keep it pretty simple so you'll understand that the brain is involved in our reproductive cycle in many, many ways. And so let me just show you this. I'm going to basically take my information from this chart. So if we can show this chart. This is my drawing of the human brain. This would be the back of the brain. This would be the front of the brain. This would be the frontal lobe in this area. This whole area is the cerebrum. This would be the cerebellum, the medulla oblongata, the spinal column. Now, we have two glands that are embedded in the brain that are important for reproduction. One of them, important for other reasons too, but I'm linking it now into reproduction. The pineal gland is deep within the brain, and it secretes melatonin. It controls our sleep cycle, our wake cycle, and it also helps to reproduce hormones. So that's pineal gland, and it's deep within the brain. The pituitary gland is in the brain too. It's only the size of a pea. It's very, very tiny, and yet it is called the master gland for a lot of reasons. It seems to control and the other glands of the body. It seems to exercise an influence upon the other glands of the body. So that's the pituitary gland. What does it do? How does it work in terms of reproduction? Well, it's small, but it controls other kinds of glands like the thyroid, the adrenals, and the reproductive glands, which would be the ovaries. It controls growth, it gives out growth hormones, and it also starts the uterine contractions in labor when a woman goes into labor. I'm interested in particularly in its reproductive capabilities on the ovaries. Now, I showed you a diagram last week in which I showed you where the ovaries were, but the pituitary gland secretes a hormone called the follicle stimulating hormone. It's called FSH. That's how you abbreviate it, follicle stimulating hormone. It comes from the pituitary, and what it does is get the ovaries active in producing the eggs. So it basically tells the ovary to produce an egg, and it keeps doing it every month, and then the egg is produced, and then things progress from there in a normal fashion, hopefully. But if you are in menopause years, or if you are, if something's wrong and the ovaries don't work, or the ovaries can't produce the eggs, it continues to secrete that follicle stimulating hormone. So it builds up in your system. That's what causes the menopause symptoms. You know, if you cannot have a child, if you've had a hysterectomy, if your ovaries have been removed, or if your ovaries are shut down for some reason, and you're not going to be able to produce any eggs, the pituitary is going to try to get the ovaries to do it. It produces that hormone, FSH, and it keeps producing, and it keeps producing, and it keeps producing. Normally, the ovary would produce the egg. There would be a hormonal change, and the pituitary would stop sending the FSH out. It would stop it. Because it would know, however, chemically it would know that there was an egg produced and things were progressing as it should during the month. But the pituitary is not going to shut down on its own if the egg is not being produced. So you keep on getting more and more and more and more of the follicle stimulating hormone. And what happens with that is you start getting all of these menopause symptoms, and menopause symptoms can go from mild to extremely severe. You might feel in the worst of moments if you're having a bad time, and usually younger people will have a bad time with menopause symptoms if, say, they've had to have a hysterectomy at a young age or something like that. because it's not normal for the body not to have estrogen. If you have had a hysterectomy and your ovaries have been removed, more than likely you're not producing any estrogen. The body is screaming for estrogen. It is something that young women really need to have, but don't have. And then the pituitary keeps on going on and plugging your body full of the FSH, and you have some really, really awful symptoms. You can go into a grocery store and feel like you want to scream. You can have very, very severe anxiety attacks where you think you're actually going crazy. You can be severely depressed. I've read a number of articles that says menopause does not give depression. I don't believe it for a minute. I've seen too many women who are very seriously depressed when their estrogen levels are low. And when they start taking birth control pills to normalize their bodies, when they're taking the estrogen, they get out of the depression and they feel good again. Then when they stop taking the estrogen because they're taking progesterone instead, if there's kind of a cyclic thing, they take estrogen for maybe 2 to 3 weeks in a month and then progesterone the last week of the month, they get very seriously depressed when they're on the progesterone, but feel wonderful when they're taking estrogen. So there certainly is a personality change and symptoms related with the cycle. Now, of course, you're going to get symptoms related to your diabetes too. If your sugar is way high or way low, you can have all kinds of personality changes. You can be very seriously depressed, and you can be angry, and you can be hostile. And, you know, I've seen this advertisement on TV. I don't want to mention the product, but there's a person coming down in the steps of a house, and they're angry and they're ready to fight. And the woman of the house says, "Here, take this candy bar," or whatever it is they're selling. And he said, "Why?" And she says, "Well, you get a little angry when your blood sugar is low, when you're hungry." So he eats the candy bar, and suddenly he turns into this wonderful woman who feels wonderful, and she's acting wonderful. And I don't remember the name of the product, but there are changes. If your blood sugar is vacillating, one thing you can do if you're really high is get so tired you can hardly stay awake. And then if it's too low, you feel so drugged you can hardly stay awake. You can go into a coma because your blood sugar is too high, but you can also go into a coma because your blood sugar is too low. So I urge you, if you're diabetic and you're swinging back and forth and you don't feel good, or you're too tired, or you're too angry, or you're too emotional, check your blood sugar and see what it is. It may be that it's off, and it may be you can correct it with either a little more insulin or eating something. But when you're in your cycle, in the reproductive cycle, the same kind of thing can happen. So you have a brain that initiates the activity of the ovaries to make sure that you have an egg produced, and then that egg goes into the uterus and either gets fertilized or it doesn't. So the brain is the initiator of all of that, and it is in the pituitary gland. I used to say when a person had hormonal symptoms because they're in the menopause and they didn't have enough estrogen, and they were feeling badly about that, and they were getting emotional, and they were getting distressed, and they were getting angry, and they were getting nervous. All of those things can be menopause symptoms. I used to say, well, the cure is just take the pituitary out. Just remove it. Have brain surgery and take the pituitary out. When a young person has menopause symptoms because something is wrong and they have to have a hysterectomy at a young age, their emotions are all over the place, and they become depressed, and they become anxious, and they have panic attacks. It can affect the vision, so their vision is blurred. It can affect their balance, so they get dizzy a lot. It can affect the way that they think, so they can't think clearly. And it's just just a bunch of symptoms, one on top of the other, on top of the other, on top of the other. And, you know, I would joke around and say you need to have the pituitary removed, and then all of your problems would be over. But of course, no one would ever do it. The pituitary sometimes does get removed because of a tumor or something that's really gone wrong with it. But normally you would never remove a pituitary gland because it secretes many, many hormones. We're just beginning to understand how much, in terms of hormones, the pituitary produces. And the body needs those hormones. And so therefore you would never remove it. Better to take artificial estrogen so that calms the pituitary down, because now you've got estrogen in your system, and so it doesn't have to keep producing the FSH, because your injections or pills tell it that there's estrogen there. Now they're talking about the fact that if you take estrogen, artificial estrogen, that you can get cancer from it. But I can remember years ago when they gave estrogen to women so they wouldn't get cancer. So you learn things as you go, and the opinions change as you go, but it's just something you need to keep in mind. The brain initiates a lot. Now, the brain starts the body to have labor pains, to go into labor. It starts the contractions for labor and keeps it up. And sometimes if the labor is slow, or they think that a person isn't going into labor but they should be, they'll take a hormone like Pitocin and inject it, and they'll get the whole thing started. The problem with that is that the pain is usually worse and the contractions more difficult if that happens. But it does initiate labor. It does initiate when the baby is going to be born. So there must be then an interchange between the reproductive system and the pituitary gland, which is in the brain. That's what I'm trying to point out to you. So as a diabetic, you're dealing with all of that. Your body is dealing with all of that. And it just makes a difference as to how you cope. You have to realize, I think if you understand some of this, and I'm not getting into it very deeply, but I've known a lot of women and I've counseled a lot of women, so I know pretty much what goes on with them when they're diabetic and when they're also pregnant and when they go into labor and all the things that go on. You have to remember that your body is a very, very complicated organism, if I can call it that. And because it is so complicated, it's affected by a lot of different things, and a lot of hormones play a part in it. And so you have to be patient with yourself. If you're a person who's pregnant and a person who's diabetic and you don't feel well and various things are happening, just give yourself permission to know that it may be all physical. It's not necessarily in your mind, and you don't have to worry about it. If you have concerns, you will have medical care. They can check and make sure everything is all right. It can be scary. If you're so tired you can't stay awake, or if you're so angry you're about ready to shoot somebody, it can be very, very scary, but it can also be explained away a lot of times with what's going on in your system. You just need to be aware of that. So I'm going to take this down, and I want to talk to you about tight blood sugar control. Excuse me. Tight blood sugar control. Now, if you're young and you're diabetic, what a doctor will want you to do is to have tight control, and I want to explain what that means. Having tight control means that your blood sugar, with your exercise, with your medications, with your insulin, you can keep your blood sugar within normal ranges, and you don't get way too high, and you don't get way too low. And when that happens, you feel good, and there's much less chance of complications. Complications are the serious part of diabetes, because complications can ruin your life. Complications can even kill you. So if you have tight blood sugar control, that means that you can, through a lot of effort on your part, with good medical management, keep your blood sugars to be pretty much normal. Maybe not completely normal, but pretty much normal. And what happens with that is there's a lot less chance that you're going to have complications if your blood sugar is normal. So the idea is always keep your blood sugars normal. Take the insulin, watch your diet, do the exercise, check your blood sugar. It's a royal pain because you're checking your blood sugar all the time. But it is true, the closer you keep your blood sugar to normal, the less likelihood that you're going to have complications. And complications, as you know, can be serious. You can go blind from complications, or you can have amputations as a complication. You can have skin disorders. You can have heart trouble. You can have heart attacks. You know, all kinds of things can happen. And we've gone over those complications as these classes have proceeded. But the research shows that people who are 65 or older, sometimes tight control doesn't work for them as well as it does for younger people. And so therefore, in an article that I just read, they said that type 2 diabetics, if they're older, 65 or older, can get into trouble if they try to have too tight control. Because what happens is they don't get the benefits of the tight control because of their age. And what's going to happen is they're going to go into hypoglycemia pretty easily. And hypoglycemia, as you know, is low blood sugar. And it can cause you to go into coma. It can cause you just to fade out. It can cause you to have an accident. And so hypoglycemic reactions, and most diabetics get them every so often, but hypoglycemic reactions are dangerous, especially for the elderly. And so tight control is something that if you're younger, it's important. If you're middle-aged, it's important. But once you get to be 65, it may be, according to this article, and there may be some doctors that disagree with it, but according to this article that I've read, that you should loosen up on the control and maybe not have such tight control, because hypoglycemia will involve heart, eyes, etc., and it's dangerous and it can lead to death. The elderly can be overtreated for diabetes, and as a result of that, they can make, to make the sugars normal, as a result of that, they can get into trouble if they are too tightly controlled. This is according to the research. People over 65, according to the article, don't reap the benefits of the tight control that younger people do. There was a test done, a diabetic test, research test, and it involved hundreds of people. And what it did was it forced, and it was of different ages, it forced people to have normal blood sugar. The blood sugar was checked very regularly, and they either gave insulin or gave food or whatever, and the idea was to keep the body at a normal blood sugar level no matter what. And they had to, after a series of months, they had to stop the study because over 250 people died of heart attacks. Now, I never read the reason for that. I don't know was it affected the electrolytes of the body or what it did, but somehow the people being forced to have normal blood sugar, and I imagine this was for all different ages, some of their bodies just couldn't take it. The hearts couldn't take it, and they had heart attacks, and they lost over 250 people. They died of heart attacks in this study, so they stopped the study. I always tried to find out more about what happened, what caused them to have the heart attacks. What was so bad about having normal blood sugar and being forced to have normal blood sugar when the body may not be used to it, the body's used to having higher sugar levels? And I don't know, I don't understand what happened that it would be that way, but it was. So there were a few hundred people involved with the study, and I don't know how much of it was age-related and how much of it was not. And I just heard little articles here or there or references to it, but I was never able to find out more information. But it's just something that you need to consider, and your doctor will discuss it with you. How dangerous is it for you to be strict enough so that you're always within what's considered to be normal ranges? Now, I want to mention, I think I have time for this, if you're traveling, If you are traveling, then you need to prepare. As a diabetic, you need to prepare with all kinds of things. And what I'm going to do is, I have a chart up here, but I don't know if the camera's going to be able to pick it up. So I'm going to read off some things. If you are packing on a trip, you've got to take, and you're diabetic, you've got to take a lot of extra medication just in case. You know, if you're overseas and you drop an insulin bottle and it smashes, you may not be able to replace it. You won't have a prescription where you can go into a pharmacy overseas and be able to replace it. So you always have to be careful and make sure you take enough of everything. And it makes it a pain to travel. I no longer travel overseas. I have before, and I've loved doing it. But now, because of insulin and syringes and the difficulties of keeping it cool, I no longer go overseas. I still travel, but I don't go overseas. So you have to plan to carry enough diabetic medication and supplies to get you through extra times. I would say if you're going overseas, you need to have an extra month's supply with you just in case something happens. Remember, if you're going to the Middle East, it's really hot. And even though buses are air conditioned, sometimes the air conditioning stops. And even though you have ice packs are only going to keep insulin cool for so long, especially if the temperature is hovering around 118 or 120 degrees. So let me read this off to you. To help you pack for your trip, here's a checklist of things to take. The diabetic pills, insulin in vials or pens, or other injectable diabetes medications. Syringes or insulin pens, glucose monitoring equipment, glucose meter, lancet devices, and lancets. And you always need 2 meters in case something happens to one, 2 of the same kind of meter, so that everything will be compatible. Snacks, diabetic identification, wallet card, necklace, bracelet, emergency supplies such as quick-acting sugar, glucose tablets, ketone test strips, and if you use insulin, bring a glucogen emergency kit. And then you may also want to take a letter, have a letter with you that describes the fact from your doctor that you're diabetic and you have to have these supplies with you. So I'm going to read off to you a sample letter. This is, let me show you this. You don't have to catch it all, but this is like a doctor's letter, something a doctor would write, and you would have it with you in case you ran into a trouble. But I'll read it off. This day, a place for a date, and it says, to whom it may concern, then your name would be put in, is a patient of mine with diabetes mellitus. All of the following supplies related to diabetes care are required for travel and need to be accessible at all times. Blood strips, lancet devices, lancets, insulin, syringes, pen devices, glucogen, emergency kit, glucose tablets, gel or candy, insulin pumps and supplies, continuous glucose sensor system supplies, and then it lists different kinds of medication, and then it gives supposedly the doctor's number. You need to have a list of all your medications, where you get them from, the fax numbers and the phone numbers of the pharmacies, and you need to have a list of all your doctors and what they're treating you for, their addresses, their fax numbers, their phone numbers. You need to carry all of that with you. Do not, and bring a lot of extra supplies. You almost can't have too much. And remember, don't send them, don't check them in. Keep these supplies and everything on your person. Have a little case that you keep everything together, because it could get lost if you store or allow your insulin to be shipped or put into a storage or something. It could get too hot, it could get too cold. So keep all of your supplies with you. So I'm going to close it here. We're about out of time, and we have one more segment that I really want to get into diabetes, and then I want to get into the emotional parts of it and talk about that, and also things that have helped people along the way, which I want to talk to you about too. So we'll close it here, and please join me next time.